Hi, this is Dr. Saurav and I will teach you medicine for NEET-PG, and I will start first with respiratory system. So let's start respiratory system. I will teach you about something specific and pointed things which will be required in NEET-PG, and if it will come handy in examinations. Okay, you will not need to remember the entire medicine. Okay, you will get frustrated about it every time you will go through notes. Just don't need it. Okay, I will teach you how to remember medicine and what are the specific things you will need in NEET-PG. Okay, so let's start respiratory system. We'll start with the first item of functional anatomy of lungs. So there are 23 generations of airway in total. Okay, 23 generations, and these are called Weibel's airway generation. Airway generations. We can divide the entire generations into two parts. One is conducting zone, another is respiratory zone. I think all of you know about this. These are some basic things. Conducting zone starts from division 1, ends in division 16, and respiratory zone starts from division 17, ends in division 23. Okay, the first generation is called the bronchi. 16th generation is called the which one? Very good, terminal bronchial. 17th generation is called very good, respiratory bronchial. And 23rd generation is called alveoli. Very good. You may not need one thing, but just remember this. There is another zone called transitional zone. It consists of division 17, 18 and 19. Just remember this, you may not need it later. We have to know about little bit of details on bronchopulmonary segments, and you will see the questions have come on bronchopulmonary segments in anatomy, in physiology, in pathology, and obviously in medicine. Okay, so bronchopulmonary segments. How many of them? There are 10 bronchopulmonary segments. Okay, I will write it down as BPS in each of right and left lung. Okay, now I have to know that how many lobes are there in right lung and left lung. Okay, how many lobes are there in right lung? In right lung we have 2. No, we have 3 lobes. Upper lobe, middle lobe and lower lobe. And how many of them are in left lung? 3. No, only 2 lobe, upper lobe and lower lobe. Okay, now we have to know about the BPS. I have already told that there are 10 BPS in each lung. So how many of them in upper lobe of right lung? There are 3. How many of them in middle lobe of right lung? There are 2. And how many of them in lower lobe? There are again 5. So what are them in upper lobe? Apical, posterior, anterior. In middle lobe, medial, lateral. In lower lobe, kindly note it down, apical, basal, and mark it at 3 star. Medial basal, anterior basal, posterior basal, lateral basal. Okay, just mark the apical vessel 3 star. I will tell the fact at the end of the BPS segment discussion. Now, how many of them in left lobe? There are 10 segments. Okay, 5 in each upper lobe and lower lobe. So, okay, say with me: apical, posterior, anterior. Okay, now have to like in right lobe there is one lobe. In right lung there is one lobe called middle lobe, but there is no middle lobe in left lung. So the last two segments in upper lobe will be not medial lateral, that there will be superior lingular and inferior lingular. 4, 5 done. Lower lobe same as right lower lobe. Just write it down with me, then it will be very much easier for you if you write with me. Medial basal, anterior basal, posterior basal, lateral basal. One of the dreadest complication in CC ward is what? You know, right? It's aspiration. Okay, very important condition. You have to keep checking on patients who remain bedridden for a long time. Okay, now just get the fact right. In supine position, which BPS, bronchopulmonary segment, will get most affected, or it may come like this: will get affected very early. Okay, it can be asked in two type of question. The answer will be, I think you all of you know that apical segment of right lower lobe. If there are any segments are asked in MCQ, so there will be apical, or it can be asked with another options like medial basal, posterior basal, anterior basal, or it can be it can come in which lobe will get most affected: upper lobe, middle lobe, lower lobe. Okay, so remember the question is a very important question. Now we have to know a little bit about BPS. What is BPS? What is BPS consists of? This consists of three structures. One, pulmonary artery. Second one is bronchial artery, and third one is segmental bronchi. So now can you tell me which structure is missing? देखो, आर्टरी है, ब्रोंकाई है, हवा भी जा रहा है, खून भी जा रहा है, पर खून आ नहीं रहा है. तो खून आता किसी से? राइट, वेन से. सो इन बिटवीन टू BPS, space in between two BPS, there is one vein. It is called vein. lungs में तो it will be called pulmonary vein. but दो segment के बीच में, so intersegmental pulmonary vein. And many times the questions came asking for the which structure is occupied by the intersegmental space. It is occupied by the intersegmental space occupied by intersegmental pulmonary vein. Okay, just remember it. Now another two important things which will be asked in physiology and pathology, and maybe asked in medicine, and just remember this: there is one disease called, and you kindly mark it as a 3-star question. There is a disease called emphysema. Details I will talk about it later. Okay, just remember two things. Emphysema, there are two types: one, centriacinar emphysema, and second one is pan-acinar emphysema. First structure which gets involved in centriacinar emphysema is respiratory bronchial. Just remember this. First structures, first structure involved. Respiratory bronchial. In panacean emphysema, it is alveolar ducts and alveoli. This is very important. It will be asked in pathology.